Welcome back in. It's the summertime, and with the summer comes the heat and those pesky summer bugs. Teresa DeTano is an epidemiologist with the Toledo-Lucas County Health Department. She's here now to go over how we can fight the bite. Please help us. Thanks for being here today.
Thank you for having me back.
Absolutely, yeah. So we love to go outside. We want to enjoy the summer weather, but it seems like we're kind of doing this all the time. Two bugs or insects in particular we really need to be careful about are mosquitoes and ticks. So
Correct.
Let's start with mosquitoes first of all. Around our area, West Nile seems to be the biggest concern, right?
Yes, it is. We have very few cases of West Nile in Lucas County and in the state of Ohio, but we do have cases nonetheless. Not all mosquitoes, and this is what we tell people all the time, not all mosquitoes carry disease that can infect us with, let's say, West Nile. But there are other diseases that mosquitoes carry as well. Malaria is another disease. Now, we typically don't see malaria in the state of Ohio, meaning we don't have mosquitoes that really carry that parasite. However, we mostly see malaria in cases that travel. International travel is kind of where we see that. So we like to present this information and provide our Lucas County residents with this kind of information on what mosquitoes can do, what kind of diseases they can spread, and if they should get a mosquito-borne illness, then we provide them with the tools in order to help get through the illness or to prevent it from happening again.
Yeah, they might be traveling, going overseas or whatever, and so you have to know this information.
Right.
So let's talk about prevention then, because clearly that's what we want to do. We don't want to get bit. And first of all, females are the only mosquitoes that do the biting. They got to get the blood to do their thing.
That's absolutely correct. Male mosquitoes do not bite. It's the females that bite. And they bite because they need the blood in order to produce eggs. So when they land on us, when mosquitoes land on us, they are not only sucking out the blood from us, but they're also in their saliva putting their saliva into our skin. Now again, not all mosquitoes carry illness, but mosquitoes don't only bite people, they also bite animals as well. And if they should land on an animal that is already infected with a virus or a parasite, they will transfer that to us. That's why not all mosquitoes carry disease. It just depends on where they're picking up the disease. What animal did they get it from? Or what area did they get it from? So those are the ones we really have to be careful of. So just when people think that all mosquitoes bite and carry disease, they don't.
Right.
That's why we see such low cases of West Nile, for example, is because not all mosquitoes carry that kind of disease.
And we just, I guess the biggest thing that we can do is spray, but we want to make sure that it's the right kind, it's going to be effective.
Correct.
So we need to check those labels.
Right. So what we tell people is they should be using an insect repellent, and that's any insect repellent that's EPA approved. And we usually, and they also should contain DEET or DEET. And you can get that repellent in any supermarket store or department store, what have you. And you can find that, but you should always spray yourself, legs, any exposed area you should actually use it on. One of the other prevention techniques we like to share is that really to prevent the mosquitoes from biting, you really should be wearing long sleeve shirts, long pants, socks, shoes, maybe tuck your pants into your socks. Now, I realize it's hot outside. Who wants to wear long sleeve shirts and wants to wear pants in the summertime? That is why it's even more important that if you're going to wear shorts or in t-shirts, that's fine, but make sure you use your insect repellent in order to prevent it. There's also clothing that you can use because mosquitoes will bite through clothing. There is also clothing that you can use, and you can use a particular insect repellent called Perthman, excuse me, I'm mispronouncing that, but it actually is only to be used on clothing, and you spray it on the clothing.
Not on your body.
Not on your body, because it is poisonous and it can make you sick if it touches your skin. It can cause red and dairies, etc. So you only use it on the clothing, and then that will at least protect the bites going through the clothes, etc. But again, one of the biggest prevention techniques is to use an insect repellent. Some of the other things for mosquitoes, if you're camping outside, sleeping under the stars, you really need to go under mosquito netting. And then you always, in the house, you also want to check to make sure that you don't have any tears or rips or holes in your screen door, windows, because it's easy for the mosquitoes to get in that way. One other prevention technique for mosquitoes is that you want to be aware of standing water, either in your backyard, in the kiddie pool.
The pool.
And how many people have kids that they put the kids in there, maybe they don't drain the water? Mosquitoes will congregate and they will live there. Also, pots, maybe plants that you had in some some pots, dog dishes, cat dishes that maybe you've put water, you want to clean that daily, make sure no standing water's in there, and any low-lying areas in your backyard. And then those areas can be treated certainly by getting somebody out there or using any of the over-the-counter stuff that, again, has got DEET in it in order to prevent mosquitoes from congregating in those areas.
Great information. We're out of time, but I did want to mention briefly, though, ticks is the other insect. So we just need to make sure that when we're coming in from outside, checking the dogs, checking ourselves.
Correct.
Doing all
Yes,
those
absolutely.
things.
Lyme disease is another one. Same types of things. Use the Lyme insect repellent to prevent ticks from biting. Same kind of clothing guidance that we give with mosquitoes. And then if you do find a tick on your body, you want to remove the entire tick by using tweezers as close to the skin as possible and removing it that way. And then always look for the warning signs of Lyme disease by looking at a bullseye rash. And it looks just like a bullseye does. And so, even though not all Lyme cases will have that, a majority of them do. So that's a good way of determining whether you're sick or not. And then, of course, some of the illnesses and signs and symptoms you would see, like fever, muscle aches, joint pain, that kind of thing.
You're not feeling well. Yeah.
Right. You're just not
so
feeling
make sure
well.
you go see the doctor. And, we'll keep you up to date with the health department as well if we see any cases of West Nile or anything like that in the area throughout the summer. But in the meantime, enjoy yourself outside. Just spray, right?
That's right. Just spray.
Thanks for being here today.
Thank you.
Appreciate it.